Good morning, children. After a long stint, we are again back with the community medicine classes. The new competency is environment and environmental sanitation. With that effect, we will be talking today on air, water, noise and radiation pollution and its effect on the human health and their prevention. Basically, it comes under the environmental health hazards. Environment is comprised of air, water, soil and kind of space. So, with all these factors, when any one of these gets polluted, then there is a problem with the human health. Over the years of human existence, there has been so many ways that the environmental pollution has taken place, whether it is the air pollution, soil pollution, water pollution, or maybe pollution due to noise or radiation. So with this background, we will be talking on these effects of air, water, noise and radiation pollution and its effects on the human health. At the end of the lecture, you will come to know about the various clues on these kinds of pollutions and their prevention and control measures. World Health Organization in 1993 defined that environmental health comprises of those aspects of human health, including the quality of life, that are determined by the physical, chemical, biological, social, psychosocial factors in the environment. Any external factor that negatively affects the health can be considered as an environmental health hazards. Here they have included the physical. Physical means air, water and the soil, maybe the sky, and then the chemical. Chemical means the presence of certain chemicals in the environment, maybe the pesticides, insecticides in the environment, or maybe the chemical gases which are coming out of the industries and the auto emissions or emissions from the petrol driven cars or the diesel driven trucks. Then there is a biological. Biological factors are those factors which often pollute the ground and as well as the air and sometimes the water. The common examples is the sewage contamination of drinking water. Social is the kind of things which are present in the society in the form of accidents, in the form of kind of scuffles, in the form of kind of fights. So these are the social elements which can even affect the human health. Psychosocial factors are bigger factors, and that can be, war, that can be social unrest. So all these factors involve the environment and ultimately the human health in many ways. The environmental health hazards comprises of air quality hazards, indoor or domestic air quality problems, the water related hazards, the noise related hazards and the radiation hazards. We talk about the air pollution. It is a burning problem in many of the urban areas due to road traffic and the constructional work. Road traffic is continuous and the emission of petrol and the diesel after burning in the car or the truck engine causes a lot of pollution. At the same time, construction work for improvisations and for kind of improvement in the infrastructures is continuous. It is also associated with the industries and mining, those which are continuously discharging the gases and various kind of toxic materials into the environment. It can be also from the wind blown dusts. It can be from the farm equipments where the agricultural farm which thrashes the crops and the products and produces lot of source for the air pollution. It can be fires and incinerators. It can be outdoor pesticides and insecticide use also. The common air pollutants are carbon monoxide, which is very common, and then sulfur dioxide, lead, hydrogen sulfide, the polycyclic aromatic hydrocarbon or commonly known as PA, ozone, particulate matters, and the nitrogen oxides like nitrous oxide and nitrogen dioxides. In this sequence, we show you the health hazards of the air pollutants. Like carbon monoxide, it is mostly produced by the industries and the mining, and in the domestic front, it is produced by the firewood and the charcoal, and it can cause the hemoglobin disorder, mostly known as the carboxyhemoglobin disorders. It is common in the winter months in the high-reach areas of the mountains where the people use sigri, which is a coal burnt or wood burnt kind of a joint wherein it produces heat inside the room, but at the same time it produces carbon monoxide, and that can ultimately lead to carboxyhemoglobinemia, leading to the fatal complications and even death. The second most important air pollutant is the sulfur dioxide. It is produced during sulfur mining, and in the domestic it is produced during cigarette smoking and even in the firewood burning. The concentration or the safe limit in the environment is 80 microgram per cubic meter. It often causes chronic bronchitis and bronchial asthma. Lead is excreted when leaded petrol is burnt, and it also comes from the mining and the other kind of traffics. So it causes hematological lead poisoning, it causes hematological disorders and neurological problems in the newborns. Hydrogen sulfide comes from the rayon industries and from the wood pulp industries. It is a very pungent gas and causes conjunctivitis and neurological disorders. The polycyclic aromatic hydrocarbon, it often comes from garbage burning, fire, and the burning of the agricultural refuges, and this is carcinogenic for skin and the lungs. Ozone is generally present in the atmosphere, in the stratosphere, approximately at 15 kilometer height from the Earth's surface. That is the natural ozone. However, ozone is produced by human being also for certain industries, especially the refrigeration industries and others, and these ozone can give rise to conjunctivitis and bronchitis. Particulate matters are produced on the road and during the building constructions and certain industries, and its safe limit is 100 microgram per cubic meter. It causes conjunctivitis, bronchitis and asthma. Nitrogen dioxide is produced during domestic cooking, and it causes acute respiratory infection in the children, bronchitis and chronic obstructive pulmonary disorders. We talk here about the indoor air pollution. Indoor air pollution is one of the common and critical universal problems. It affects mainly the women, children and the elderly. It contributes to ARI in the young children and chronic lung disease and cancer in the adults and adverse outcomes in the pregnant women. It is generally produced by the firewood and the coal used for cooking, and those are significantly contributory for domestic pollution. In this particular sequence, it has been shown the sources of the domestic pollution. Out of all the sources, you can see the two star marked source, that is the combustion of gases in the fireplaces and wood burning stoves, and cigarette smoking among the family members are the most important. However, there are other sources like chemicals released from the modern building and the furnishing material, chemical released from the paints and the solvents, gases like radon seeping through the foundation, and then there is animal hair and dander, and chemicals from the cleaning products, molds and bacteria, and outdoor air pollutants seeping inside the house. These all contributes to the source of air pollution inside the house. The indoor air pollution consists of the kind of respirable particle like tobacco smoke and the stove and the aerosol spray. Then it has got carbon monoxides like from the combustion equipment, stove and the gas heaters. It has got nitrogen dioxide from the gas stove and the cigarettes. It has got formaldehyde like from the particle board, carpet adhesives and the insulations, and it has got asbestos which may come from the insulation and the fireproofing. All this cause conjunctivitis, acute respiratory infection in the infants and children, bronchitis and COPD in the elderly age group, and carcinoma and adverse outcome in pregnancy. WHO has pronunciated that the cleaner biomass or the biogas stove can avert 1 million deaths from chronic obstructive pulmonary disease, mostly among the poor women, and also nearly 1 million deaths per year from the childhood pneumonia, and reduce the climate changing black carbon emissions in the world. We now talk about the prevention of air pollution. WHO recommended the following procedures for the control and prevention of air pollution. It has got 5 components: containment, replacement, dilution, legislation and international actions. Containment is the prevention of escape of the toxic substances in the ambient air, and it can be achieved by enclosure, ventilation and cleaning. The industrial emitted gases can be put into a chamber, and then it can be kept on hold for some time till it is released, and during that time most of the heavy particles will precipitate, like most of the carbon particles and most of the dust particles will precipitate. And then sprinkling water can be used to further reduces the gas load of these emitted gases, and thereby the pollutants in the emitted gas from the industry can be reduced. So this process is known as containment. Replacement is replacing a process causing air pollution by a new process that does not. Like nowadays, leaded petrol has been replaced by unleaded petrol. In some places, the kind of petrol engine has been replaced by the electrical engine in the private cars. So these are the, like domestic LPG has replaced the firewood and the charcoal. So these are the kind of things which are known as replacements. Dilution, it is valid so long as it is within the self-cleaning capacity of the environment. Some air pollutants are also removed by the vegetations. The vegetations are known to remove carbon dioxide, carbon monoxide, sulfur dioxide and even the nitrous oxide. Legislation, air pollution is controlled by suitable legislations all over the world, like we have Clean Air Act, Smoke Free Zone and also the auto emission regulations applicable for the cars and the trucks. Certain other common preventive measures to prevent air pollution are to use low sulfur fossil fuel, to reduce the automobile emissions by regularly checking the engine of the car and its emission, the zoning of industries from away the human settlements so that the emitted gases from the industry does not affect the environment of the human settlements and the residences, destroying pollutants by thermal and the catalytic combustion, changing the pollutants to less toxic forms by precipitation and followed by further cleaning and sedimentation, by precipitation of the pollutants, modifying the agricultural practices, like in certain agricultural practices, especially when the agricultural refuse are burnt at the end of the whole process, that may be stopped. Prohibiting incineration and garbage burning, replacing coal by LPG as domestic fuel, smoke-free zone in the public places, and cigarette smoking needs to be prohibited in hospitals, in public offices, in certain places, and regulation of the industrial emissions. All these preventive measures can go a long way to prevent the air pollution in our community. Now we come to the next topic, is that the water pollution. Water pollution is generally by the industrial and domestic wastes which can pollute the water resources in the urban area. In rural areas, the same water bodies are sometimes used by the humans and the livestock, and that water gets polluted very soon. And the problem of water pollution is very high in the rural areas where the piped drinking water supply is not available. The sources of water pollution are many. However, the fertilizers from the lawns, gardens and the agricultural farms pollute the water. Mercury from the power plants and the industrial waste also pollute the water. Herbicides and insecticides often pollute the water. Oil and other chemicals from the roadway runoff is a source of water pollution. Medications, paint, toxins which are seeping through the domestic sinks and the toilets can be one of the sources of water pollution. Trash and sediments from the construction site also cause water pollution. Pet and animal droppings, faulty septic tanks and the sewage wells and the domestic discharge often pollute the water. Runoff from the industrial sources and the discharge from the sewage treatment plant also can pollute the water bodies. In this sequence, we have shown a kind of mercury cycle in the environment and the mercury pollution for human being, how it can take place. You see the mercury is coming from the natural strata of the earth strata down below the kind of a reservoir of a water, and this gets evaporated and goes into the environment as mercury ions. At the same time, certain industries like the industries, power industries and other industries, they are producing mercury vapors and the SO2 vapors. They combine to form the AgSO4 ions in the environment, and these along with the water becomes acidic and ultimately gets precipitated through rain into the water in the upper strata of the water. In the water, it is taken along with it gets into the biological process and gets into the insects and small insects, and it is eaten by the fish, and ultimately from the fish it gets into the human system. So, this is the way the mercury pollution generally takes place. The diseases, the modes of transmission of disease by water pollution are many. Like one can have disease when drinking and washing with the contaminated water, or eating seafood from the polluted lakes and the lagoons, or crops harvested in the polluted water, or there is sewage farming, swimming in the polluted water bodies and contaminated groundwater. There are many diseases which are caused or effects of water pollution on the human health, and these diseases, either they are infective diseases or they can be the toxic chemicals diseases. Infective diseases are viral hepatitis A and E, poliomyelitis, rotavirus, gastroenteritis. There can be typhoid, paratyphoid fever, amoebiasis, giardiasis and the helminthiasis. The toxic chemical diseases are carcinoma, liver, kidney injuries, the neurological problems. If there is a lead poisoning, then there can be neurological problems, skeletal and dental fluorosis. If there is excess fluorine in the water, it causes skeletal fluorosis or dental fluorosis. There can be dermatitis and there can be chronic allergic reactions. So, these are the kind of many diseases which are transmitted through the polluting agents in the water. What are the steps to be taken to prevent the water pollution? Prevent the groundwater contamination by all means. Greatly reduce the unnecessary waste of water. If you waste water, then the resources are exploited, and in the future there will be problem to get water. Reuse the treated wastewater for irrigation. Try to make afforestation. Find the substitutes for toxic pollutants and work with the nature to treat the sewage. Practice the R's, 3 R's, 4 R's of the resources use, that is the refuse contaminated water, then kind of reduce, try to reduce the contamination of water, recycle and reuse the treated water. And last but not the least, reduce water, air and soil pollution, and all these three will ultimately conserve the water resources and make it available for the future generations. Certain practical steps have been given over here, like turn off the tap when running water is not required, use environmental friendly household products, avoid overdosage of pesticides and insecticides, don't throw the non-degradable substances into the water bodies, rivers, lakes and oceans, and treat the industrial wastewater before leaving into the water bodies. We can help prevent water pollution by avoiding unnecessary spraying of the insecticides and the pesticides. We can avoid idle immersions in the water bodies. We can try and disseminate the awareness on water pollution, and also can participate in cleaning up process. There are certain public health measures which can help purify the water, and these public health measures, like you have physical process, filtration, sedimentation, biological process like slow sand filters and the rapid sand filters. The separate classes will be taken for water purification. Chemical process like flocculation and chlorination, radiation by ultraviolet ray, and ultrafiltration by the reverse osmosis. There are certain water acts like Clean Water Act 1972, Marine Water Protection Act 1972, Safe Drinking Water Act 1974, and Oil Pollution Prevention Act 1990. Now we come to the discussion on noise pollution. Noise is an unwanted sound in unwanted time during the most unwanted facets of life. So it comes from the traffic, trains, buses, trucks and aircrafts, helicopters, constructions noise, low flying planes, jet engines, and the air conditioning units, as well as the mobs and the processions. Exposure to noise level higher than the 85 decibel for a long period can cause the permanent hearing loss. Lower levels have been shown to cause stress and increase the blood pressure, sleep disturbance, which affect the sleep quality as well as the mood and the performance. The noise has got two kinds of health effects. It's an auditory effect and a non-auditory effect. Auditory effect has got two facets, two counts: auditory fatigue, that is 90 decibel or 4000 hertz, and deafness, that is exposure. It can be temporary or permanent. Exposure to more than 4000 to 6000 hertz can cause temporary deafness, and permanent deafness is the chronic exposure to more than 100 decibel of sound can affect the internal ear organ of Corti. Rupture of tympanic membrane at 160 dB can happen. Non-auditory effects of the noise are speech disturbance, which is often seen in during the traffic or in the railway stations or bus stations. Annoyance, reduction in the work efficiency, there can be economic loss, and the physiological changes like sleeplessness, increased pulse, increased blood pressure and breathing, sweating and nausea. The noise can be prevented by certain technologies that we will be now talking about. One of them is most important, that is the construction technology. We can utilize sound insulation by reducing the transmission of the sound using barriers like thick glass and the concrete materials. We can use sound absorption technology by using the acoustic tiles, acoustic foams, acoustic fiberglasses, acoustic sealant. And we can even use the vibration damping technology, where we can make application of material of surface like wooden vinyl boards and the acoustic glass wool panels. In the construction, we can even do a proper town planning, where we can separate the industrial areas, residential areas and the traffic zones, and wide green belts can be given between the main roads and the residences. Control of vehicles and the pressure horns. Heavy vehicles are generally not allowed in the narrow streets to avoid the traffic jam. Pressure horns are prohibited during the daytime and even in the night. Unnecessary honking is also prohibited, and punitive action can be taken if a person is found to be honking unnecessarily. Silent zones like the hospitals, universities, offices are to be signposted for prohibition of the horns. Traffic regulations and punitive measures are to be instituted. For personal prevention measures, periodic monitoring of sound level at industrial and residential areas to be made for monitoring and surveillance. Periodic examination of the workers working in the noisy environment. They should be rotated their job, and they should be put to the protective ear gadgets like the ear defenders. Health education and legislation also should be there. Minimum use of the loudspeakers in the near silent zones like the hospitals, offices and the residential areas. Banning pressure horns in the automobiles, prohibition of the firecrackers and prohibition of the noiseful social festivities. Finally, we come to the radiation hazards. Radiation is the sources of radiations are two types, mainly the natural radiation and the man-made radiation. Natural radiations are cosmic rays, the terrestrial radiations from the environment, and the atmospheric radiation from radon and thoron gases, and the internal radiation from the carbon-14 and the potassium-40. The natural radiation permissible limit is 0.1 rad per year. Man-made radiations comes from the X-rays, radioactive fallout from the environment like strontium-90 and the cesium-137. Electronic appliances also produce certain amount of radiations, and there can be accidents like nuclear reactor accidents, Chernobyl disaster, what happened in 1986 that caused a very high radiation disaster in Russia. The effects of radiations are threefold. There can be acute radiation sickness, there can be delayed effects, and there can be transgenerational effect. The acute radiation sickness is manifested by acute illness, headache, vomiting, weakness, multi-system failure, severe infections and septicemia, bone marrow dysfunction. Delayed effects are leukemia, carcinoma and the fetal abnormality, and transgeneration effects are chromosomal mutation, genetic defects in progeny and the sterility. There are many ways to prevent the effects of radiation and exposure to radiation. We need to remember that as low as reasonably achievable, that should be our idea, that is the ALARA principle. There are three effective strategies for shielding and three effective strategies for distance. We can shield ourselves with the help of the concrete wall, can be thick glass wall by the lead shields, and there can be the plexiglasses, plywoods and other things. We can maintain a distance from the source, and by maintaining the distance from the source we can reduce the exposure to by 25%. For X-rays or gamma rays, we need to use shielding. The lead shielding will reduce the intensity of the X-rays and the gamma rays being emitted from the source of radiation. To reduce the exposure by certain desired percentage, the lead shielding must be certain thickness for each type of emitters. There are certain rules in the radionuclide laboratories, like smoking, eating and drinking is not permitted, food and food containers are not permitted, and radionuclide work areas shall be clearly designated and should be isolated from the rest of the laboratory, and all work surfaces should be covered with the absorbent paper, which should be exchanged regularly to prevent the build-up contaminations. Further, the radiation safety in the laboratory rules that includes the protective clothing shall be worn when working with the radioactive materials, and this includes the laboratory coats, the glasses, the gloves, etc. Dosimeter shall be owned, and all containers of radioactive material and items suspected or known to be contaminated shall be properly leveled with the tape or tagged with a radiation logo like written radioactive. All contaminated waste items shall be placed in a container specifically designed for radioactive waste.